Good afternoon, Hattiesburg. Thanks for joining us for this COVID-19 briefing for Monday, November 9th. We'll start with today's numbers and we'll go straight to hospitalizations. Today, between Merit Health Wesley and Forest General, we have 59 people who are COVID positive, which is about 6 over where we've been for the last 2 weeks. We have another 1 under investigation. And of those 59, we have 26 people who are in the ICU right now. As you can see in this next chart, that's actually one of the higher amounts we've had in some time. We haven't had this level of hospitalization since September the 13th, and so highest point in almost 2 months. And so that's something that we should be concerned about. Again, this always sort of tracks. You see higher positive rates, and then it's followed a few weeks later by higher hospitalizations and ultimately higher ICU utilization. And so that's what we're seeing right here. Today, statewide, again, this is a day where the lab ran on Sunday, so you're likely to see lower totals, but 516 new cases reported today, no new deaths, which is a good sign. However, we did have 1 new death reported on Saturday in Lamar County. We send our condolences to that family, which brings the totals to date 82 deaths in Forest County and 42 in Lamar. In terms of new positive cases, Forest County saw 15 on Saturday, 11 on Sunday, and 5 today. Lamar County had 26 on Saturday, 10 on Sunday, and 8 today. So metro area weekend total 75 new positive cases. To date, Forest County is at 3,287, Lamar County is at 2,510, metro area total is 5,797. Our 5-day average, of course, with the 3 days that were slightly under what we saw toward the end of last working week, those numbers have come down a bit. Both Forest and Lamar counties are now under 20 in each county in terms of new positive cases in terms of 5-day average. Inside 14 days, this is the number of people who have received their positive test back in the last 2 weeks. In Forest County, that number is at 218. In Lamar County, that number is at 239. With the weekend numbers, we rebounded quite well. Kind of saw a bit of a concerning spike, but still we're staying under 500 in terms of metro area totals, and both counties are staying in that mid-200s range. Week over week, we're 7 under in terms of active cases from last week. Again, using the inside 14-day number. Lamar County is 5 under where they were, and then metro area total down 10 from last week. Of course, the concern, though, is the week over week comparison and hospitalizations. 53 to 59 this week, and then 20 to 26. Both of those are the highest we've seen in some time. Our goals continue to be protecting the vulnerable, people over the age of 60, people with underlying or chronic health conditions. We want to see we want to prevent overrun of the healthcare system by slowing the spread, so that if and when you need healthcare, it's there for you. And then continuing to prioritize public health while giving the private sector the space to operate. Some things that we lean on doing during COVID-19 is widespread availability of testing, wearing masks. We watch our own data and report that to you, and of course, listening to all voices. One of the leading voices in our community has been Dr. Rambod Rubash. He was at the very first stakeholder meeting that we had between hospital and county and city governments, as well as our educational institutions. And he really has been a go-to person in terms of giving information and being a voice on what's happening as this pandemic unfolds. And so as news this morning broke of the Pfizer vaccine trial and it being 90% effective, I reached out to him to say, hey, is 90% a good thing, and what's the schedule in terms of vaccine development? And also had reached out on our Instagram and to see if you had any questions. And so he spent about 10 or 15 minutes with us, was very generous with his time, and asked several questions regarding the vaccine and where we are with COVID-19. And so now we'll turn it over to our conversation from earlier this afternoon with Dr. Rubash.
We're glad now to be joined by Dr. Rambod Rubash, who is a Hattiesburg Clinic physician, but also director of the Family Medicine Residency at Forest General Hospital. Dr. Rubash, thanks for being with us today.
My pleasure. Thanks for having me.
So today we got news that Pfizer announced that its vaccine has been proven in its first sort of trial, 90% effective on preventing COVID-19 in individuals that had not had it before. And is 90% a good amount? I mean, in terms of how this lays out compared to other vaccine development, how good of news is this?
Really good news, surprisingly good. Just to put it in perspective, the average flu vaccine is about 50% effective, somewhere between 40 and 60% at best. About the best vaccines that we have are in the 90% range, about 93 to 96% safe for measles. So for this coronavirus, which has shown that it can mutate, to have a 90% efficacy on the initial analysis is really, really good news. It's also very good news because the Pfizer vaccine was using the novel mRNA technology, the spike protein technology, similar to the trial that we have here with Moderna to show efficacy in this novel sort of vaccine is really, really good news.
So in terms of just what this means going forward in terms of timeline, I mean, do we think that will people be able to get the vaccine by the end of the year, by the spring? I mean, how do you see this based on where we're at now? How does this lay out going forward?
Okay, so it's important to know how these trials kind of roll out. So this is a very preliminary data analysis. So when you have a clinical trial, there's all these other entities involved, including an institutional review board that makes sure the process of the trial is ethical. And then there's an external data management company whose job it is to unbiasedly look at all the data that you submit to them. So this data management company looked at, I think, 94 cases for the Pfizer trial and gave this announcement of the 90% efficacy, which means essentially that of the 94 positive cases of the roughly 40 some odd thousand people enrolled in the Pfizer trial, about 84 of them were in the placebo arm, so roughly about 10 of them were in the vaccine arm after they have gotten the 2 doses of the vaccine. So now they have to actually publish this data. This hasn't been peer reviewed. We don't know how rigorous this data is, if it was efficacious for elderly adults as well as young adults, sick adults versus healthy adults. We don't know that yet. So none of this has been peer reviewed yet. But assuming it's all great news, assuming it's all fantastic, the data is clean, it protects everybody all the way across. Now, in the face of this pandemic, you can apply for what's called emergency use authorization. And if best case scenario, all the data is good, all the protocol was appropriate, we may be able to have a vaccine available by the end of this calendar year. And then you ask the secondary question of how do you roll this out? How many doses will they have? I think they said they'll have 50 million doses available, which means that 25 million people will get the 2 doses required. And you got to decide who gets them. Is it going to be frontline workers? Is it going to be elderly? That all depends. So the rollout will be complicated as well. So for the general public, I would say this probably isn't going to be available at your local doctor's office till probably the spring. For a select group of people, that may be the first priority, maybe at the beginning of 2021.
And assuming like the Moderna trial that you guys have participated in and other trials, and if they kind of show the same sort of results, they could also apply for that emergency use from FDA.
Absolutely. So when you go to your doctor's office and get a flu vaccine, you don't necessarily know which vaccine you're getting, which company it comes from. There's multiple flu vaccines available. And depending on where you go to get yours, you could get this company's flu vaccine versus the other. So hopefully we'll have a bunch of these vaccines available. Hopefully they'll all be this efficacious. And then we can have various doses available at various sites, and you won't have to necessarily pay attention to which particular manufacturer's vaccine that you're getting.
Okay. One question that folks are having now is they're trying to make plans for Thanksgiving if they haven't already done so, and they're even thinking a little further ahead in terms of Christmas. What advice would you give to families? Because typically you invite in folks, maybe grandparents, or you go to see the grandparents, or you've got aunts and uncles that come in. You know, is there a safe way of doing that kind of gathering, or what are some alternative plans that you have seen in terms of how to safely gather with folks this holiday season?
Okay, so let's assume we want to gather and eat. So there's 2 different things going on. We can gather all we want as long as we wear a mask. We're likely going to be safe. And the schools have really proven this for us. And that was a pleasant surprise that I had personally not expected, to see how well the schools did in rates of infection, given the fact that they were all using masks. So that's good news. We can get together probably with masks on for several hours and be okay. Now, if we want to eat and take our masks off, probably the safest way to do that is to distance, similar to what the schools have done, and ideally to do it outdoors. we have the benefit of 70-degree temperatures sometimes in November. So especially here, if we can do it, I would advise to do it outdoors and space yourself as much as possible. Gathering around a small living room or dining room and taking off our masks and eating for an hour or two is likely not a safe thing to do, especially with our elderly and older parents and grandparents.
Um, we're 8 months into this pandemic now, and how do we as individuals, as businesses going into a hard shopping season, or even communities now that are trying to hold the line in terms of masks and things like that, how do you prevent pandemic fatigue and keep us from getting apathetic?
Well, that's a great question, and I don't have a scientific answer for that. So this answer that I'm giving you is my own personal opinion, not based on any studies, because I think we are going through this as a species for the very first time like this. My advice would be to focus on the good news. And the good news is masks work. And if you want to live your life and if you want to go out and do things and shop and do these things, just wear a mask. And the better we are with wearing masks, the more of us that wear masks, the better off we're going to be. I mean, I was struck by some of the images I saw over the college football weekend where Notre Dame, stormed the field after beating Clemson. And then you look over at my beloved Pac-12 and those stadiums are completely empty. Those are very different approaches to the same sort of phenomena. So I'm not saying we can't go to football games, but I do think we should be masked when we do it. So I think we can focus on what is helpful. We have tests available now that we didn't back in March. So if you've had exposure, you can go get tested and retested and then quarantine if need be. But if you want to limit your risk, really the best way of doing it is mask. And let's focus on the good news. Remember, we used to freak out about bleach and Clorox and all the surfaces. We've come to find out that's really not a big focus of spread with this illness. That's good news. So you don't have to worry about your groceries that are developed and letting them sit in the sun. And remember, we were doing all these things back in March and April. We can chill with that. Just put on your mask. Don't touch your face unless your hands are clean. And I think we can live a pretty normal life. The one caveat is we just have to be a bit careful when we take the mask off to eat.
Yeah, it's all about finding the functional normal. So as we move into flu season, as we get this information on vaccines, as a new administration is coming in January, it appears, how would you recommend that people get accurate information? And in terms of, of course, there was the whole confusion on whether we should wear masks or not at the beginning because they were telling them to stockpile it and leave it for first responders and medical professionals. But for the average person, where should they get their news in terms of the latest when it comes to COVID?
I think a very reliable source is the CDC. And you have to understand, even the great CDC, which is hailed around all other countries as the preeminent infectious disease source, got some things wrong. And, to be honest, these are humans making human decisions based on data that's emerging. But overall, I have been very, very reliant on the CDC. And I think if you want to get straight to the source, go to the CDC. You're going to get accurate information there. I will say it is a huge website, and you can get yourself into little rabbit holes similar to a YouTube rabbit hole. So bear in mind, it is expansive, but there are different sections for healthcare providers and the general public. And I think if you have a question about universities, if you have a question about churches, you will find it on the CDC site. And I think it's a reliable resource.
Okay. One last question for you. I know that we have actually a couple of things. Are we seeing reinfections locally? I mean, I know that for a while there it was you get it once and you're done, but I mean, are we seeing reinfections locally?
So officially, there have only been a handful of reinfections absolutely proven throughout the country. I think we're up to 5 cases. And that partially has to do with the difficulty in actually proving it. And I know this because I was involved in the investigation of a local reinfection case. So I'm quite certain we've had at least one instance of a local reinfection with an early case in March with a repeat PCR test that was negative with antibodies positive, and then a repeat test back in October and having that come up positive. I'm fairly certain that's a reinfection case. However, when we went to go prove it, what we had to get is not only a PCR swab now from October, but we had to get the original PCR swab from March and hoping that that laboratory retained that. And what you do then is you take those 2 swabs and you genomically sequence them and see if it's a different strain, and that's how you prove that you had a reinfection case. Unfortunately, in this anecdote that I'm providing you, we did not have the original swab from 7 months ago, which is why it's so difficult to prove reinfection. But if we're talking about biologic plausibility, yes, there is a possibility of reinfection because we know there are different strains. We know that from the minks in Denmark that had to be culled because there was a mutant strain in those minks that then jumped into humans or has the potential to jump into humans. So this is an evolving virus and will likely mutate and will likely cause a secondary infection. And of those cases that we do have documentation of secondary infection, unfortunately in the US, those cases were more severe illness the second time around than the previous ones that were documented in Asia and China, in which those secondary infections were completely asymptomatic. So the answer to your question is, if you've already gotten it, if you're one of the 120,000 Mississippians who have had this illness, it doesn't mean you're out of the woods, and you should continue to mask. And oh, by the way, even if you yourself don't get sick, you can harbor the virus from a reinfection and then pass that on to people with a sneeze or a cough. So really, the gospel here is the masks. The masks are really what are going to save us, especially during flu season.
Right, finally, last question. I know that this pandemic has pointed out a lot of strengths and weaknesses in our health system, and probably in just the way that societies conduct business and how we live our lives. What have you seen here? Any idea of pieces of our health infrastructure locally that we can improve on because of what we know now with COVID-19?
I think the biggest thing, if I was king for a day, is coordination. The idea that individual states, individual counties, individual cities, individual health systems are kind of on their own to figure out testing will lead to the circumstances that we had back in March. And I know, Mayor, you were intimately involved in this, where we were trying to find tests. And because we were the first, we had good access to the State Department of Health. But then when we got on the line and said, hey, we started a COVID clinic, can you provide us with rapid tests? The answer became no. There's no access to the national stockpile. There's no more tests available at the state level. So we literally had to walk across the street to USM and go into their microbiology labs and say, hey, do you have any of this juice? We need some of this juice to make our own test. And the idea of having to do this just off chance and just off the fact that Dr. Fitzpatrick happened to work in a microbiology lab as an undergraduate in Boston and said, hey, I think I can make this juice, that is not a reproducible model. So we need to have some sort of coordination, at least at the state level, preferably at the national level, where we say, here are our resources, here are the places that need them. All right, New York, you're getting pummeled, you get it now. Well, right now it's Wisconsin that's getting pummeled and South Dakota. Now you get it. We need that level of coordination because frontline healthcare workers, we have no idea where the resources are. We're used to making an order and having that delivered magically a la Amazon. Well, in the face of a global pandemic, those resources are not ubiquitous. And then to have these physicians and other professionals try to find these resources is not a good utilization of our resources. So if I were king for a day, when it comes time to manage a war, which is essentially what this is, you need to get all of your resources together and fight this war together. We can't have different disparate responses because it's airborne. You know, when I live in Jones County and drive into Forest County and then go over to Lamar County for soccer, these different rules, the virus doesn't abide by these rules. It doesn't check me at the border of Forest County to see if I'm abiding by these rules. So we can't manage it this way. We have to be together all as one and give up a little bit of our individualism for the sake of a global war.
We'll leave it right there. Dr. Rubash, thank you so much, not only for joining us today, but also just there are going to be a lot of heroes that are talked about in 2020, and you and Dr. Batson and so many others and healthcare workers on the front lines are part of that. So thanks for being here today, and best wishes to you this holiday season.
Likewise. Thank you, Mayor.
And we are glad to have Dr. Rubash with us, and we appreciate him taking time to answer questions that you sent in. And as we go through this pandemic, we'll take questions again and pass those along as well. But thank you, Dr. Rubash, for joining us. Finally, our act of courage today. Of course, this Wednesday is Veterans Day, and Veterans Day is one of those events that we, as a city, really want to make sure that our citizens are recognizing and celebrating and remembering, why we have this holiday. This year, so many of our veterans, especially our older veterans, have been isolated, have been away from family and friends, and have not received the same visitors as they normally do. And I really want to encourage you, if you can't make any of our events this year, please take time to write a note, to make a phone call, to Zoom with somebody, and just say, hey, thanks for your service, and how are you doing? That's probably the best service that we can do right now, is to be an active friend, to seek out those who can't get out right now, and to make sure they're just doing okay and checking on their own mental health. We do want to invite you to two events that if you'd like to come. Of course, Veterans Day, we start the events actually at 11 a.m. Tuesday. We have a kind of a candlelight vigil, and we have the Air Force ROTC from Southern Miss who marches around the columns. Of course, the columns have our 173 individuals from our communities who have died throughout the wars that we've had in our nation's history. At 7 p.m. Tuesday night, they will read all 173 names, honoring those individuals who gave their lives in one of the wars in our nation's history. But then 11 a.m. Wednesday is our annual Veterans Day ceremony, where we honor our Veteran of the Year, which we will share with you in tomorrow's briefing. But also to just, again, have our veterans present, say thank you, recognize them. If you come on Wednesday at 11 a.m., please wear your mask, and the chairs will be socially distanced. But again, Veterans Day is more than a sale. It's more than a day off. We want you to live in active gratitude, particularly on Veterans Day. As we start the week, remember to wash your hands, take care of yourself. Please wear a mask. If you go out in public, do only what is essential. And remember, you're safer at home. Have a good rest of the week.